just want to have a quick, clean conversation with Julian. I'd like to talk about some of the insights I had while I was in hospital, but it's quite a conversation that you and I have been having about what a clean question does as opposed to other questions. So it started with a conversation I had with a mum a few weeks ago who said that her daughter had said, "Oh, I really want to have a good relationship with you, but I'm stuck." And I was thinking, that's such an interesting little statement of a bind.
Mm-hmm.
And I was thinking, if somebody said that statement to me, what would I do with that statement? And I thought, well, because I'm clean trained, I would say, "Oh, what kind of stuck?" And when you want a good relationship, is there anything else about the good relationship that you want? Or what lets you know you'd like a good relationship? Or even just you want to have a good relationship and you're stuck, what would you like to have happen? There's like lots of, you would take those two statements, "I want to have a good relationship with you, but I'm stuck," and you would take these two experiences and you would just accept and extend it. And so I've been playing with that in my mind for a little while.
Mm-hmm.
It was probably about 5 weeks ago, maybe 6 weeks ago, that we had that conversation. And I've just been playing with it. But then when I was in hospital, I broke my leg 3.5 weeks ago, and it needed surgery, so I was in hospital for a week. And I would watch the doctors come round, or the healthcare givers. And you can track, because I didn't have anything else to do, you could track where either the doctor or the healthcare giver's attention was compared to where the patient's attention was.
Mm-hmm.
So if the patient rings a buzzer and says, "I don't feel well," some healthcare givers, the ones who, to my mind, they have a much harder shift, will say something like, "Well, do you feel sick or are you in pain?" And it's a A or B. And the patient said, I don't know, I just feel awful." And they say, "Well, if you don't know, how am I supposed to know?" And I'm listening to this and thinking, wow, that was very quick. That was a very quick between "I feel awful" to, "Well, if you don't know," to some kind of shaming. And I'm thinking, where is the healthcare giver's attention? So it must be on what is the action that's required of me. That's where their attention is. What do I have to do? And if you compare that with, there was a different healthcare giver called Steph. Same patient, because I was in the same ward for a while. And when this healthcare giver came through, Steph would through, same patient would ring their buzzer. And Steph would come over and say, "Oh, what's up?" So, "I feel awful." She'd say, "Oh, do you, honey? I'll sit down here. Let's work out what's going on." And Steph would sit down. She'd take her hand. And she'd say, "What does it feel like?" And she'd say, "I don't know, I'm just really uncomfortable." She said, "Are you?" She said, "Let's think about what it might be." And there's something completely different about the adjacency. So when Steph did it, her attention was adjacent to the patient and to helping the patient build a relationship between the statement and her experience, such that Steph and the patient could work out what the patient needed.
Mm-hmm.
And that was such a different experience from, "Well, if you don't know, how am I supposed to know?" And it kept pinging me back to this conversation from this parent when I was thinking, oh yeah, I want a good relationship with you guys, but I'm stuck. So both of those things are true. And I'm thinking that you could really disturb that conversation with a child by saying, "Well, what do you want me to do about it?" Or, "Well, you keep doing this," or, "Well, if you want a good relationship with me, we need to do that." Or there's so many responses to that require a premature evaluation, or require the patient or a child or somebody to know more about the situation than they do right now. Does that? It's like the clean questions allow you to build a relationship with your own experience and the words you're using to describe it, as well as, or before we all try to rush to solution. So, and it was similar with the doctors. It was similar with, so when you watch it around yourself and you think, oh, if you don't give people space to think, then, and you don't create the safety, the belonging, and the freedom for them to think simultaneously, then you end up, like with the first healthcare provider, that patient rang her buzzer all the time. And the healthcare provider got more and more frustrated, and then the patient would bang their cup because the healthcare provider stopped coming to the buzzer. The rest of the patients were disturbed. Whereas when Steph was on, same patient, same bay, same ward, the patient worked out that what was wrong was that she was thirsty. And it took a little while for Steph to work that out, but then she got a drink for her, and then she anticipated, she's like, okay, we're going to put this here, you're going to do this. She said, do you like water? And the patient said, no, not really. She said, what's your favourite drink? She said, oh, I like blackcurrant. And she said, well, if I get you a bit of blackcurrant juice, will you drink a little bit more for me? And it was just a little back and forth, that then she could get the patient to drink. When the patient was drinking, she wasn't so dehydrated. When she wasn't so dehydrated, she had more energy, then she felt better. Do you know? So the difference in the quality of attention, the adjacency of attention, meant that when Steph was on, that patient wasn't disruptive on the bay. And when Steph was off, she was always disruptive. And obviously it wasn't my job to give advice. And I was thinking the similar with this parent and this child. It's like, what you want to be able to do is to stay with that and go, to be compassionate or empathic of, isn't that a difficult situation? If I want a good relationship with you and I'm stuck, I wonder what that's like. What kind of stuck? What kind of good relationship? When you're stuck and you want a good relationship with me and you're stuck. Is there anything I can do now that would support you when you're stuck? Do you know? And there's something about the quality of a clean question that can transform these conversations. Or maybe it's easier to see it in the negative. There's something about the lack of quality of attention that turns these conundrums into more drama. And clean questions, the gentle curiosity in clean questions is the antidote. That's what I'm thinking.
Interesting. I keep thinking about, when you say quality of attention, I'm thinking about the caregiver, or both actually. It's quality of state as well. Because if that caregiver's full of their own, I've had a shit day, I'm anxious, why are you bothering me? It's kind of hardly attention, is it? Yeah.
And it's similar, if we do have a difficult relationship and you say to me, I'd like a good relationship, but I'm stuck. If my attention is on how I feel about my relationship with you and things that I'm upset about or hurt about or angry about or worried about, then that's where my attention is as well, and not. So it's to do with the ability to self-regulate before, you self-regulate, then you ask the question.
Yeah.
That in turn role models self-regulation for them. They ask themselves the question, and now we're both in a self-regulating relationship.
And I was thinking, it's even a step before that. If I could remember, if I want to get more out of this next interaction, we both get more of what we want, I need to go self-regulate, then question.
Yeah.
So it's a kind of intention, isn't it?
Yeah, because I think you can still ask a clean question from an unregulated state and it can be horrible.
Yeah.
I think that's one of the things when people are first learning clean questions, is because their attention is on the questions, or their anxiety about it, or is it the right question? And that dysregulates the person they're asking the question of.
Yeah. So I think the Steph's state probably, as you've said, trumps everything else. She was calm enough to go, you're right. It's not a clean question, but
just take a hand.
Yeah. touch.
Let's sit down and work it
A
out.
clean touch.
Yeah. All right. Thanks for that. I just wanted to be able to capture a bit of that while it was still in my mind.
Yeah, pleasure. Great.